Well, hello.
Hey.
You're looking awfully studious today.
Am I?
Yes.
I have lots to talk to you about. This is my son, Dr. Shepard.
Nice to meet you.
How you doing, young man?
We're filming this.
Filming what?
Filming my doctor's visit so I can make sure I don't miss anything.
Okay. I wish you told me to go through hair and makeup first.
Oh, Jesus.
I got your bone marrow biopsy results.
Okay.
They look consistent with what's called multiple myeloma.
Okay, that's what you told me last week.
Okay. Multiple myeloma is a disease where white blood cells, called plasma cells, grow out of control.
Okay.
They can kind of take over the bone marrow. They could potentially be responsible for some of your bone pain. It's definitely responsible for your anemia. Okay. This is a disease where the treatment is very rapidly evolving.
What do you mean by that?
I mean that there's a lot of good therapy for it, the disease, okay? It is not a disease that we generally technically cure. We kind of keep trying to find things to prolong remissions, okay?
So it's not curable?
It's not curable at the present time, no. One of the things we like to do, and I'm going to ask you to do, is we see people in conjunction with Emory University.
Okay.
And they will get their treatments done here locally and go to Emory once they're in a remission to be considered for what's called an autologous stem cell transplant. What autologous means, though, is it's your own cells. It's not like a transplant from somewhere else where you have risk of graft versus host disease. It's not that. It's just high dose chemotherapy, basically. But it's to the point where your counts would not recover on their own if they did not get stem cells from you first to give back to you after the therapy. Okay?
So could they take the stem cells and save them?
Yes.
Okay.
That's what they do.
So did they combine that with chemotherapy?
Yes, we'll start therapy here locally. The regimen we use is called RVD. It is not a traditional chemotherapy regimen. None of these drugs would have been on the market even 12 years ago, probably. Maybe I don't think so. About 12 years ago, none of these drugs would have been on the market. They're not traditional chemotherapy drugs.
Okay.
That doesn't mean they're without side effects, and I'm going to give you information on all of them. Okay?
When you say not traditional...
Meaning that we don't associate them with hair loss. There's no horrible nausea and vomiting for you to expect. The
Is it more like a smart drug where it goes straight to the...
If I had to call it a smart drug, I'd say the Velcade is more so than the Revlimid. The Decadron is definitely not a smart drug. It's just, an immune suppressant. These are cells that are normally in your immune system, so the Decadron is just a steroid. And it calms your immune system down. It helps you to tolerate the bortezomib as well, or the Velcade. And you'll understand more about that when I show you how the regimen looks. You know what I mean? How we administer it, what days you get things through. The Velcade is an injection. Everything else is a pill. Okay?
You said an injection, like in your stomach?
In sub-Q tissue. I mean, wherever they can find it. My stomach would have plenty, yours not so much, but I mean, hips, whatever.
So wherever they find the cancer?
No. It has nothing to do with where the cancer's in your bone marrow.
Okay.
Okay, we're not messing with your bone marrow. This is just sub-Q. It gets absorbed. It's systemic. All the treatments are systemic. Okay, meaning that whether it goes through your mouth or whether we inject it, it's going everywhere. It's absorbed into your circulation and it's treating your whole body.
Now, when you say treat your whole body, does it kill good cells as well?
It does, but that's when I kind of started to say it's not traditional chemotherapy. Not to the extent that what you would hear about that would be nerve-wracking with some of the other drugs. You know what I mean? Like I said, I'll bring you in sheets to describe each drug's side effect. The Velcade, the most troubling side effects tend to be neuropathy, numbness and tingling in your fingers and toes in particular. Some people have cardiac issues with it. So these are just things that kind of we have to follow. And we have to watch your blood counts. Okay, they will take your blood counts.
Okay,
lower.
so what would be the difference in stem cell and bone marrow transplant?
We rarely ever do a bone marrow transplant anymore. I mean, a bone marrow is what you hear about traditionally. I mean, they take somebody else's bone marrow out of their bone, literally, and inject it into your bone.
And that doesn't work as well as stem cell?
Well, it's a much more painstaking process. I'd have to let you talk to the transplanters about the exact difference and how well they work. The point is we just don't have to do it that way anymore.
But which one has better results, or do they have the same?
Well, they're doing them all peripherally now with stem cell harvest. So I'm assuming the stem cell harvest has the better results.
Okay.
It's the outcome of the transplant in total that you're looking for. And we have drugs now to allow you to put your stem cells into circulation out of your bone marrow and just through your bloodstream. And then they can just draw your blood and harvest them out.
Okay.
So it's much easier and less tedious and painful and traumatic than having your bone marrow drilled in repeatedly.
Okay. You told me before that there's no like stage 1 to 4 with bone marrow cancer.
Well, myeloma, we can repeat your staging. Myeloma has staging 1 through 3. So leukemias don't have stages.
Okay.
You know, if this was AML, it would just be AML. But myeloma does have stages, and it's based on your protein levels.
Okay.
And we'll repeat those today. You're getting labs done today.
Okay.
Okay.
Where am I?
I'm going to repeat your test today. Based on where you were before, I'd say 2.
Okay. So how long does it take to get to a level 2?
I'm not sure I followed your question.
I mean, to get to level 2 in your stage of cancer, how long does it take? 10 years, or does it start out that way, or?
There's really no way to tell. I mean, it's a snapshot. You know what I mean?
What about, do we know how, could it be, I looked it up finally, I did have a lot of radiation when I was on life support. Is there any way to find out how I got it? It's not hereditary. Is there any way to tell how I got it?
Not really.
And do I need to do those x-rays you wanted me to do?
Your skeletal survey?
I've had so much radiation.
It's for staging. I'd like you to, because we don't really have anything that's looked at your spine yet, or your hips. You did have chest x-ray.
Yeah.
And you had a bone scan at some point, but bone scan is not the right scan for this. So you do need a skeletal.
Can they do it all at one time?
Yeah, they'll do them all at one time. They'll do your skeletal survey.
Or do they have to go in and do an x-ray here, an x-ray there?
It's all the same day. They're going to shoot different bones.
Okay.
So you're going to get your humerus, your femur, your hips,
I can feel,
your skull.
I do feel pain.
Okay.
The other question I wanted to ask you was, you know, when I originally went into the hospital, I was having pain like my kidney area, and then it went up through my chest, and it was like excruciating pain. The pain medication I'm taking now is keeping me from having any kind of pain like that. But
Great.
what was that pain from?
We could have been passing a stone at the time.
Or could it have been that my blood levels were so off the charts? Would that have made me go into pain? I mean, that's what took me to the hospital to begin with, was that excruciating pain.
No, I don't think it would be to do with your blood levels. Your protein levels have been high, but they're not that high. And usually when your protein levels get off the chart or really high, it manifests itself by things that are symptoms of your blood being too thick, like shortness of breath, heart attack type pain.
That's the way it felt.
Stroke.
It felt like heart attack, but they looked at my heart. My heart's great.
Yeah, which is great.
Yeah. Awesome. Okay, these are the questions I have for you.
Sure.
Okay, I need a copy of my
Bone marrow report.
bone marrow test results.
That's
They're
fine.
awesome. And also a copy of my diagnosis, so I can take it to.
It's on your bone marrow report.
So this, okay, so this is everything I need to get everything I need. My friends are doing a bike ride for me to
Okay.
raise money for my therapies.
Cool.
Let's see, I wanted to talk to you about my medication. I try not to take too much of that medication. The oxycodone is the only medication I'm taking. Well, not the only one. I always take meloxicam.
Mm-hmm.
I take one of those in the morning with 2, and usually that's all I need for the day, but some days I need 4. So instead of having to come all the way up here to get my medication, is there any way, because he's given me 50, and he said take 2 to 4 a
He who?
day. Your PA.
Okay.
He said take 2 to 4 a day. I try not to take 4 unless I really need it, but there's about 14 days out of the month that I need 4 because I'll start hurting in the afternoon or late in the evening.
Mm-hmm.
I try not to take it because it keeps me awake. And I haven't been to another doctor yet to get anything to make me sleep at night, so I really try not to take it because it keeps me wide awake. The oxycodone keeps me awake.
Mm-hmm.
So if you can give me anything for sleep, that'd be awesome.
Okay. It's not a problem.
Okay, talking about the meds. So, okay. I was wondering, after you do the labs today, can you check, because after I did my bone marrow test, I felt even more tired. So I don't know if I need more blood or something. I don't know. I've been even more sleepy and just really tired and achy a little bit more than normal.
Mm-hmm.
So I don't know if, having extra blood in there, if I'm low on blood or whatever. I wanted to talk to you about that. We talked about the cause. And we talked about the x-rays. Okay, and how progressed it is. And you're saying that this will never go away, I'll just be in remission, so I'm never going to be able to get rid of this?
That's where we're at now. I don't know what the future may hold.
Is it something I can die from?
Pardon?
Can I die from it? Because why? Why would I die from it?
Because so let's just say right now, let's say if we didn't start treating you, okay? Ultimately, your bone marrow would become full of these cells.
Okay.
You wouldn't make the white blood cells you needed to fight off infection. You wouldn't make the red blood cells that you needed to keep oxygen going through your body, okay? And you wouldn't make the platelets that you needed to stop bleeding, okay? So
You mean like if I got cut, I would bleed it out?
I mean, that,
Maybe?
if you had not a cut,
Okay.
let's say you fell and hit your head,
Gotcha.
that kind of thing, it'd be internal, you know what I mean? More so than any of that would be the infection risk, okay?
And my immune system
The
being
immune
right.
system being down.
I got that. Okay. When you looked at my scans, did you see lesions anywhere?
No, that's it.
Okay.
I just reviewed actually all your scans before you came in because I was kind of surprised, given the scans that you had done, that there hasn't been any obvious skeletal involvement anywhere.
Okay.
And you had the CT when you originally presented, and there was no signs. They didn't make any mention of disease then. And then you've had a chest X-ray, which would include your ribs at minimum. They
Yeah.
don't get a good picture of your vertebrae when they do that. It's the wrong side from the X-ray side, but that did not show any lesions either.
Okay.
So to the extent that we still need to do the imaging, I want to look at your head and I want to get a better look at some of the bones with your skeletal survey.
Okay.
But otherwise, there's not been any evidence of definitive bone disease from myeloma.
Okay. And what's the possibility of it spreading?
It's a blood disease, so we don't really talk about it spreading or not because it's in circulation.
So
Right.
it can.
Well, it by the nature of it being in your bloodstream, a bloodstream disease, it kind of just always is.
It is spreading then?
Well, it's not. I guess the shortest answer is yes, it's spreading, but the long drawn out answer would include the fact that it doesn't really have any choice but to be everywhere because it's in your circulation. It's a bloodstream disease, right? So it's not like as if you had a lung cancer that was sitting in one place
Gotcha.
and could decide if it was going to enter into the bloodstream or not,
Okay.
right? This is a disease of blood cells.
Okay.
So it starts out in circulation. So by its very nature, it's a systemic
Okay.
disease.
Okay. And there was mention of seeing something on my liver. Did you see anything? I just heard it one time that there was one mention of it, and I don't know. Can't really even remember where it came from.
A lot of times people have like meningioma or a little cyst. Here's your CT of the chest. I guess you got this done when you were having that pain. They didn't mention anything about your liver then.
Okay, good. That's great. Okay. I'll get the other x-rays. Okay. That's fine. Okay, bone marrow. Okay. Okay. All right. Now here's the kicker for you.
Okay.
All right?
I get to have a kicker.
Yeah, you get a kick.
Okay.
You're going to get a kick out of this.
Okay.
Okay, first of all, I'm going to heal.
Okay.
Okay, I'm going to tell you that. I am going to heal.
Awesome.
Okay?
I'm with that. I like that kick.
You like that?
I like that kick.
Okay,
Next kick.
next kick. You don't know me well
Mhm.
enough to know because I've been sick most of the time that I've been in here and saw you and a mess. My background, my mom died of cancer, breast, and then it went everywhere once they started doing biopsies and stuff. So my background is in holistic healthcare, and I've studied under the best in the United States. I had a clinic in Alpharetta for 16 years.
Mm-hmm.
And I've worked with Brenda Cobb of the Living Foods Institute. And this all might sound different to you because I don't know how much you know about holistic healthcare.
Mm-hmm.
I studied, I'm an iridologist. I studied with Dr. David Pesic, who had a clinic for many years in Florida.
Mm-hmm.
Iridology is the study and the science of the iris of the eye. And he actually dissected stuff that would come out of people's bodies. And I've worked with cancer patients. I've worked with everything, and with some of the top people in the country. I've been doing research. Before I can do a stem cell, I have to do some other therapies, and I need to build my immune system up. And I hope you're down with me, because this is what I have to do. I want to do ozone therapy.
Mm-hmm.
I want to cleanse my entire body of parasites, my liver, my kidneys. I'm going to do nothing but raw, organic food.
Mm-hmm.
I've already started that. I've already started the parasite cleanse. And when I build my immune system up, I might have to go away. I'm trying to find everything in one place. And then again, I might be able to do everything in Atlanta. But the stem cell, I'm all down with it. The chemotherapy, let's check my blood after I do what I have to do and go from there with the chemotherapy.
So you need the key. Okay, so
I'm gonna
You
tell
do-
you what. Do you know what ozone therapy is?
I'm not familiar with ozone therapy.
Okay, it would be where. Do you do any type of surgery at all?
Mm-mm.
Okay. I need to have a port put in.
Mm-hmm.
I don't know if you do that with some chemotherapy. You do that with,
Yeah, sure.
but you put a port in, and then the ozone therapy, it's oxygen.
Mm-hmm.
And after 12 to 24 treatments, my uncle was a doctor too in Arizona. After you do 12 to 24 treatments, that oxygen, cancer can't live in an oxygenated environment. That's one of the problems. They don't have enough oxygen. So after about 12 to 24 treatments, that oxygen is all the way into your bone marrow. And it's been proven to be very physical therapy. So I
How long
can't.
does it take to get 24 treatments?
I think they did it over 1 year. So I'm gonna.
So, you know, if you want to do it before you start therapy,
I have to, and you can't do that oxygen, you can't do that without any kind of transplant devices. And bone marrow transplant and control oxygen. And they told me that they're not in a situation, I don't know how much they would I'm open to everything to talk about, but my main director is but he was pretty good at talking
I don't have any qualms or issues. Okay? I will say if I were you, anything I could do in conjunction with starting treatment, I would do it. Okay? Like if you want to do your raw foods and raw vegetables and numerous other supplements, we could do that in conjunction with therapy. Okay? I still want you to go see Dr. Newcomb, who is our colleague at Emory. So you're there. We'll get these baseline labs here today. It's important to me for you to feel comfortable on your own. Very important. I would much rather we just go ahead and get started. Don't go over anything like that. If this is something you feel very passionately about, where if you want to do it and something went wrong, whatever, you wouldn't feel like it was, we could perhaps do it. I want you to follow the lab right here. So
I'm not cutting this off at all.
if you want to go, first off, I would want you to start this ASAP.
I'm gonna try to start my treatments here in Atlanta,
Okay.
instead of going out of town or Mexico.
And then I'd want to do labs no less frequently than every 2 weeks.
Okay.
And I'm going to go ahead and give you the information on these drugs that I want to start. Okay? And like I said, I want you to go see Dr. Luca at Emory. And his colleagues. They kind of help facilitate treatments and transplants with us.
I'm gonna look.
Okay. Well, I want you to look.
And I'm gonna have great quality of life.
And I want you to have a great quality of life. That's what I mean. I'm not going to.
And working together is phenomenal, and I'm glad that you, are down with, my grandmother's thing too as well.
It's a great way to put it. We need to get you through your journey as well as we can. You need to be comfortable on your journey. Okay? I want you to be realistic with you.
Oh yeah.
If we're doing these treatments and things are getting